Mr. Speaker, this morning I rise to provide my honorable colleagues and the people of Bermuda with an update on the 6-month Dementia Care Services pilot program launched by the Ministry of Youth, Social Development and Seniors in October of 2023. The pilot program was implemented to ensure persons living with dementia who are uninsured or underinsured have access to dementia care community support services. Mr. Speaker, dementia is an umbrella term for a degenerative terminal brain disease that impacts a person's ability to perform daily activities and make decisions. Dementia is becoming a global public health issue due to an aging population and risk factors, and Bermuda is a part of this trend. In Bermuda, we have an estimated 1,500 persons living with dementia. However, when we think of persons impacted by the disease, the number of persons affected by dementia is much higher than the number of persons diagnosed as dementia. Care services are usually provided for by family members. And as such, it is critical that dementia care services not only support persons with dementia, but also those persons who are their carers. Mr. Speaker, international best practice supports the development of dementia navigation programs that assess, educate, and support persons with dementia and their carers to help support a quality of life over the disease progression. These programs, such as the Care Ecosystem Model out of the University of California, San Francisco, have proven beneficial in reducing hospital admissions and increasing the quality of life for persons with dementia and their caregivers. Technology.
Continue on, Minister.
Mr. Speaker, due to the lack of dementia navigation and support services and charitable services that financially assist, family carers tend to experience a strain in maintaining persons in their homes. Also, poor support of family carers can result in hospitalizations, care crisis scenarios, and early admissions to facility-based long-term care. It is also critical to note that due to the deficits in available long-term care beds and daycare, persons with dementia requiring placement must remain in the community longer, placing additional strain on existing supports and increased risk. Aging and disability services struggle to support these clients due to their limited access to specialist support services. Mr. Speaker, consequently, in November of 2023, I shared with this Honorable House that the Ministry of Youth, Social Development and Seniors funded a 6-month dementia care services pilot program. The purpose of this pilot was to provide support and intervention services to persons with dementia and their carers while assessing the need and impact of such a program. The specialized support and intervention services provided under the pilot program included environmental assessments, cognitive screening, cognitive compensatory strategies, personal care planning, case management, caregiver education, and crisis intervention and prevention. Mr. Speaker, I also shared previously with this Honorable House that North Star Dementia Limited, a local dementia-specific care provider, was contracted to undertake the 6-month pilot program commencing in October of 2023 to offer these services. March 31st, 2024 marked the end of the pilot program, and we are pleased to report that the data was collected and collated for services provided during that period. Mr. Speaker, a total of 50 persons with dementia who were either underinsured or uninsured were provided dementia care services during the pilot along with their carers. The following are some of the key findings from the pilot program. 71% of the clients held future care insurance, 4% were uninsured, and the remainder had private health insurance coverage. 87% were unable to contribute financially to the cost of services. 45% of persons referred did not have a formal diagnosis of dementia. 71% of the primary caregivers were female and predominantly children of the persons with dementia. 49% of caregivers rated their current stress level as severe. And 5% of clients had no next of kin or family support available. Mr. Speaker, for the participants in the pilot program, 46 required an initial consultation, only, which includes identifying signs and symptoms of dementia, guidance on how to get a diagnosis, identifying needed and available resources, and the next steps of recommendations. Another 46 required the full comprehensive dementia assessment plus follow-up case management services, including crisis, intervention, and prevention. Despite the short period of the pilot assessment, all programs performance measured obtained positive results from clients. Some of the feedback included the following. 90% of the clients find the services provided as beneficial, 10% somewhat beneficial, 60% stated they are much more knowledgeable about dementia in general, 75% of caregivers stated they are somewhat less stressed than before receiving the services. 55% stated their confidence had increased to implement care strategies. 55% indicated they were more aware of local resources to help persons with dementia and their carers. 75% of carers felt somewhat prepared to meet the caregiving needs of their loved ones, with 25% stating they felt very prepared post-engaging in the dementia pilot program. Furthermore, Mr. Speaker, the following key actions occurred more amongst clients. 70% had a formal diagnosis by a medical profession. 40% of clients put a healthcare directive in place. 75% put an enduring power of attorney in place, and 60% had their mental capacity assessed. These actions are critical in obtaining a diagnosis of dementia. It is key so that you and your loved one knows what lies ahead and are prepared. Advanced planning is necessary to ensure those diagnosed can make their own decisions for as long as possible and have their wishes and preferences known and upheld when no longer able. It is encouraging to see when people have access to support services, progress occurs in the areas that are essential to help ensure a better quality of life. Therefore, Mr. Speaker, as a result of the positive outcomes obtained during this dementia care service pilot program, the Ministry of Youth, Social Development and Seniors has extended the pilot for an additional 6 months from June to November of 2024. The data shows that the need is evident and growing. Also, moving forward, the ministry is committed to identifying sustainable funding for the provision of these services. Mr. Speaker, this is not the only action the government is taking to address dementia in our community. My honorable colleagues may be aware that June 15th, 2024 was recognized as World Elder Abuse Day, and the theme adopted by Aging and Disability Services this year was Dementia Staying Connected. This was an important theme as those persons with cognitive impairment and care needs are more at risk of abuse and neglect. As a result, the annual Seniors Tea held by Aging and Disability Services hosted over 100 seniors who received information on dementia, risk reduction, and support services available through presentations by Action on Alzheimer's and Dementia and North Star Dementia. In addition to the Seniors Tea, in recognition of World Elder Abuse Day, I made a virtual proclamation on June 14th, while officers from the Aging and Disability Services shared on the radio stations about senior abuse and the importance of supporting persons with dementia. Additionally, Mr. Speaker, a dementia action plan is being developed under the National Senior Strategy, which I will share more about in a future ministerial statement. The action plan is being prepared collaboratively with the Bermuda Health Council and includes our community and government partners to ensure we can collectively identify and implement comprehensive and targeted solutions to help address the needs of persons with dementia and their carers in Bermuda. Mr. Speaker, in closing, a dementia diagnosis can be daunting for the person impacted and their family. So having affordable access to a resource for education, guidance, and support is critical. The Ministry of Youth, Social Development and Seniors is committed to working with our public and private sector stakeholders to expand and improve dementia services and support. We thank these partners and look forward to our ongoing collaboration. Thank you, Mr. Speaker.